Hi everybody, today we're gonna have a conversation between a doctor and a patient. Alright, so the conversation is focusing on asthma. Asthma. You guys know what is asthma. So we have a doctor and a patient. So the doctor asking a patient, how are you feeling today? Other doctor can also ask, what brings you here today? Alright. What's the matter? What brings you here today? How can I help you? Okay. So the doctor can ask, what brings you here today? What can I help you? What's the issue? What's your symptoms? So the doctor can ask many type of questions like, what's your symptoms? What's the matter? What brings you here today? Or simply can ask, how are you feeling today? Alright. Doctor can also ask, how is your health today? Alright. How is your health today? Alright. This is a doctor health today. Alright. How is your health today? Or the doctor can also ask, are you feeling okay today? Are you feeling okay today? Alright. Are you feeling okay today? What's your symptoms? Alright. What brings you here today? How can I help you? Alright. The doctor can ask different type of questions, okay, but goes with the same meanings. Alright. Now let's see what is the patient response to a doctor. The patient responded, I feel short of breath. Alright. I feel short of breath. Alright. This is patient, short breath. I feel short of breath. The patient got dyspnea. Alright. The patient got dyspnea. Alright. Or the patient can also respond with this question, I have difficulty breathing. I have difficulty breathing. Alright. I have difficulty breathing. Alright. Breathing, difficulty, breath, breathe, breathing. Alright. Or the patient can respond with this, I'm struggling to breathe. I'm struggling to breathe. Alright. Struggling, breathe. Let's take a look at it again. So the doctor asks a patient, how are you feeling today? Or the doctor can ask, how is your health today? Alright. Or maybe the doctor can ask, are you feeling okay today? Or the doctor can ask, what brings you here today? What's the matter? What's the issue? How can I help you today? Alright. So the doctor can ask several types of questions, but the same meaning. Now this is the patient respond. I feel short of breath. Alright. The patient having difficulty breathing. So here I have a difficulty breathing, difficulty. Alright. The patient have a dyspnea. Dyspnea means short of breath. Alright. Or maybe the patient can respond with this, I'm struggling to breathe. Alright. Breathe, struggling. Alright. Now let's take a look at this one. So we have feeling, health, breath, breathe, breathing. Short of breath. Short of breath, we also call it dyspnea. Alright. Also you can say shortness of breath. Alright. SOB. Difficulty, difficulty, or you can say struggling. Alright. Feeling, health, breath, breathe, breathing. Short of breath, shortness of breath. We simply call it SOB. Difficulty, or you can say struggling. Alright. So these were the common terminology we used. Okay. Alright. Now let's move ahead. Doctor asking a patient, do you have asthma? So this is ASTHMA. So we're gonna pronounce asthma. Alright. Asthma. Do you have asthma? Or the doctor can ask like this. Have you been diagnosed with asthma? Have you been diagnosed with asthma? Alright. Or the doctor can ask, is asthma a known condition for you? Is asthma a known condition for you? Condition. Alright. We simply call it condition, disease, or disorder. Alright. Is asthma a known condition for you? Alright, so we have the patient. What patient responded? The doctor asked, do you have asthma? Or the doctor can ask, have you been diagnosed with asthma? Alright, diagnosed asthma. Or maybe the doctor can ask, is asthma a known condition for you? Alright, condition, disorder, or disease is the same thing. Condition. Alright. So the patient responded. Patient said, yes, I have asthma. Because the patient have a difficulty breathing, he have a shortness of breath, we simply call it dyspnea. Alright. Because of asthma, he got shortness of breath. Alright. Yes, I have asthma. Right. Or the patient can respond, yes, I'm an asthma patient. Alright. I'm an asthma patient. Or the patient can respond with, yes, I suffer from asthma. I suffer from asthma. Alright. Suffer asthma. So the patient responded. The doctor says, do you have asthma? Or the doctor can ask, have you been diagnosed with asthma? Or the doctor can ask, is asthma a known condition for you? So the patient responded, yes, I have asthma. Alright. Or the patient can say, yes, I'm an asthma patient. Or simply he can say, yes, I suffer from asthma. So this is a very easy one, super easy. Alright. So we have the difficult words over here. So we have the asthma, diagnose, condition, doctor-patient conversation, or you can say doctor-patient dialogue. And this is suffer, right? Asthma, diagnose, condition, doctor-patient conversation, or suffer from a disease or disorder or condition. Alright. Alright, now let's see what is next. So, doctor asking a patient, are you using any inhalers? Alright. Are you using any inhalers? Inhalers is a medicine can use. Alright. Are you using any inhalers? Inhalers. Or the doctor can ask, do you have any inhaler? Do you have any inhaler? Or maybe the doctor can ask this way, are you taking asthma medication? Medication, or you simply call it medicines. Alright, drugs. Medicines, medication, or drugs, okay? Are you taking asthma medication? Are you taking asthma medication? Or maybe you can say, are you taking asthma medicines? Alright. Now, let's see what is patient responding. The patient responded, yes, I use an inhaler daily, every day. Alright. Inhaler. Yes, I'm using an inhaler every day. Oh, yes, I use an inhaler every day or daily. Alright. Inhaler. Or maybe the patient can respond with this. Yes, I use my inhaler regularly. Alright. Regularly. Regularly. Yes, I use my inhaler regularly. Alright. Or maybe the patient can respond with this. Yes, I often, same thing. Alright. Yes, I often use inhaler for asthma. So inhaler is crucial. It is very important, especially for asthma patient, to carry on in their bags or in their pockets, right? So yes, I often use inhaler for asthma. Alright, let's recap. So first of all, doctor asked a patient, are you using any inhalers? The doctor can say, do you have any inhaler? Okay. Or maybe the doctor can ask a patient, are you taking asthma medication? Are you taking asthma medicines or drugs? Okay. Medication, medicines, or drugs. Alright. So same thing. So the patient responded, yes, I'm using an inhaler every day. Or you can say, yes, I use an inhaler daily. Alright. The patient may respond with this, yes, I use my inhaler regularly. Regularly means every day, daily. Alright. Inhaler. Or maybe the patient respond with this, yes, I often use inhaler for asthma. I often use inhaler for asthma. Alright. Alright, now let's take a look at the difficult words. So we have the inhaler, asthma, medication, or you can say medicines. Alright. Regularly. Inhaler, asthma, medication, medicines, regularly. Alright, now let's see what is next. Next, we have a doctor asking a patient, how often do you use it? Means, how often do you use inhaler? How often, or how often do you use inhaler? Alright. How often? How many times a week? Or how many times a day? How often? Or the doctor may ask, how many times do you use it a day? Or how many times do you use inhaler a day? Alright? How many times do you use inhaler a day? Or maybe the doctor can ask a patient, what is the frequency of use? Okay? What is the frequency of use? Alright, so the patient responded, about 3 times a day. Alright? About 3 times a day. Or maybe the patient can respond with, I use it thrice daily. Alright? Thrice daily. I use it thrice daily. Alright? Thrice. Or the patient may respond with 3 times each day, once, twice, thrice, quad, penta, hexa. So once means 1 time, twice means 2 times, thrice means 3 times, quad means 4 times, penta means 5 times, alright? Hexa means 6 times, alright? Just keep in mind. Alright, so let's recap, alright? Let's recap. So the doctor asking a patient, how often do you use it? Okay, how often do you use inhaler? How often do you use your inhaler? Or maybe the doctor can ask, how many times do you use it a day? Or how many times do you use inhaler a day? Or maybe the doctor can ask, what is the frequency of use? Okay, means inhaler use. The patient responded about 3 times a day. Or maybe he can respond with, I use it thrice daily, right? Or he can respond with 3 times each day, once, twice, thrice, quad, penta, hexa. Alright? So this is the easy one. So we have the difficult words. Here we have the inhaler. Alright? Asthma, inhaler. Also here we do have the same thing, inhaler. This one is frequency, alright? And other things are quite easy, alright? So this is once, twice, thrice, quad, penta, hexa. Alright, so this was all for today. I'll see you in the next.